Welcome to Get Moving TV. I'm Dr. Chris Landon and I serve as your host. Ventura County, there's just so many hidden treasures here. We've gone over lots of them over the last decade. The musicians, the artists. We have scientists here too. With me today is Dr. Robin Evans. Dr. Evans, welcome to Get Moving TV.
Thank you so much.
So you and I met, well, how long ago was it now?
Oh, I don't know. Good question.
A year or so?
Yeah.
So I'd heard about you kind of floating around. Oh, we've got a plastic surgeon somewhere in the Canal Valley, and he's got an interest in pediatrics. Pediatrics is like, Velociraptor. I heard a human body in the other room there, and so it took us a while to lure you in. But the journey to becoming a pediatric plastic surgeon, in fact, it's a calling. Nowadays we think of doctors and go, it's a job. It's not a priesthood anymore. It's a job where people try and keep their lives in balance, work and play and spirit and family. What the heck? What happened to work, grab your heart and die?
Right.
But it has to be satisfying too. But how did you get to where you are today?
To where I am. Yeah. Well, of course, I'm Canadian. So born and raised in Canada, did all my schooling in Canada. And I think you said it rightly, that it's a calling, but it's also like a very privileged calling. It's not something that everyone gets to do, and it's something that I'm very fortunate to be able to do every day. So, but I think the confusing part is when you're starting out and you're, in elementary school, you're in high school, and you start thinking about what you want to be or do for the rest of your life. And I think the more important question is who you want to be. And that walking towards trying to be the person that you are is actually the most important decision that you could make. And then the details happen. So for me, I actually went into university later. So I actually took a couple of years after high school, and I went into university later, which really allowed me a little bit of a different perspective. So I took all sorts of amazing courses that I missed, the philosophy courses and mathematics courses, and of course lots of science, and ended up applying to medical school. And the blessing is I was accepted. And I went into medical school thinking I would be a family practitioner. I come from a small rural community in Canada, and I thought I would go back to this rural community. I'd have a little practice. I would deliver babies. People would bring me eggs from their farm. I would have that kind of life, and it just wasn't to be.
Well, generally behind every great man, there's a great woman pushing too. So
that's true.
I know your wife, and
yes,
she's very capable of pushing. So
absolutely.
When did you guys meet?
Well, we're high school sweethearts. So we met. She was 16 and I was like 18, and we met through common friends, and it was love. So we dated for years and years and years, and of course, got married, and we now have 5 kids. So my wife is amazing in many respects. In her own way, she's accomplished great things, and most of all is being married to me and being the wife of 5 amazing kids. So that's a lot going on.
It's a lot of ranch management and
that's right.
small animal farms
that's
and
right.
Everything else.
And along that process, she decided she wants to be a triathlete. So now she's an Ironman, and has done all these amazing things. So, yeah.
So here in the United States, I mean, you're looking at probably $250,000 to $500,000 in loans that have to be paid off. Is the Canadian system for supporting schooling different then?
Yeah, good question. There are government loan programs, but it's the same dollar value. So we accumulated a lot of debt during that time, and that gets scary. After a while, because of course you don't see the return on it, and you're holding your breath for well,
4 years of school, 4
right,
years of
it ends
medical
up being
school,
about
and
13,
then,
14 years of education before you're actually making an income, and then you have to start your practice. So it's not like you're all of a sudden making a lot of money. You're beginning to build. So it takes a long time. Yeah.
You graduate from medical school. Oh, he'll be going to
Yeah.
family practice. Finally, I'll be able to. You want to do what?
Well, this is it, right?
Yeah.
So I'm in medical school, and I quickly realized that being a family practitioner is not how I'm built, and learning about who you are, what you're good at, what you're not good at, and what you really love, only happens once you start walking that path. So here I am, where I'm in medical school, and I have an opportunity actually through a friend of mine, an amazing mentor who invited me to come to the operating room. And it was there, actually in doing cardiac surgery, that I saw the operating room is where the miracles happen, right? And there's no experience like actually being beside someone and even literally holding someone's heart. I mean, it's so special. There's no words for it. And it's really sacred, I think is the right way to put it. And so that's how I look at the operating room, as a very sacred place. And that's a place where miracles happen, and I get to be a part of that. So it was clear that's what I had to do. And in fact, I thought maybe cardiac surgery is the thing, right? Cardiac surgery is an amazing specialty. And in fact, the most interesting part of cardiac surgery is pediatric cardiac surgery. That's actually the most interesting stuff is actually takes place with kids, and they have a lot of very complicated congenital problems. So I ended up setting up an elective at Harvard, at the Boston Children's Hospital. I went down to the Boston Children's. There I am, this little Canadian guy, and I had my suit on and my tie on, and I show up, and the guy I was supposed to do the elective with had left. There was this upheaval in the department, and he had left under these, very, political, problems. And so I didn't know what to do. I was supposed to be there for months. I had nowhere to go. Luckily, I had a friend who had just completed fellowship, and I called him up. I said, do you know anyone? And he goes, in fact, I do. So he picked up the phone, and, amazingly, I ended up working with a plastic surgeon. And so I was actually at the Massachusetts Eye and Ear, where I started working with plastic surgery. And you never forget your first case. Like I thought to myself, oh no, like I really don't want to do breast augmentation, and it just, that's not really an amazing. I'm not really changing people's lives with that, am I? But sure enough, it was a pediatric case. It was actually a young boy who had a tumor of his midface. It had eaten almost his whole midface. And we performed a huge resection of this tumor. And then we did what we call a free flap, which is we took a gracilis muscle, which is a muscle from his leg, and reanimated his face with it. Reconstructed it, basically a free muscle transfer, and allowed him to not only have a face, but to actually have a face that moved. It literally did change my life. It was a moment in time where I realized what was possible, right?
Well, I tell people, good TV is when you cry, and you're making me cry. So I just said, I remember the first baby I delivered, I fainted, and the intern had to catch me. So I go, well, probably not obstetric. So yeah. Well, good. So you've completed your training. Now we have lured you to Ventura County Medical Center.
Yes.
And there are some programs that you've put into place. Can you talk about Dr. Starr, some 30 years ago,
30 years,
in the hall with me at my clinic. He said, could you help me start a cleft lip and palate clinic? I go, sure, not a problem. We put it together, and first year we didn't have a single patient. We ended up going down to Honduras to operate. Now it's a very solid program, which you've inherited.
Yeah, I have. Yes, yeah.
So tell me about cleft lip and palate and incidents in Ventura County and San Luis Obispo, Santa Barbara.
Our cleft program. So cleft lip and palate is a congenital problem where the face doesn't properly form. We're actually, in utero, we're made of little blobs, and those blobs have to come together and knit together in very particular ways. And cleft lip and palate is when those blobs don't actually knit together like they should, and you end up with a hole. Sometimes a hole in the lip, sometimes that hole extends through the teeth, and sometimes it extends through the lip, through the teeth, and into the palate, which is the roof of your mouth. That can cause a whole slew of problems, including difficulty speaking, difficulty eating, and then there's a social component of not looking like everyone else. And a lot of these babies are completely normal, other than the fact that their lip is separated. So the care for these babies requires a team, and that's the cleft lip and palate team. And the cleft lip and palate team is made up of myself, the plastic surgeon, but it's also made up of, it takes a community, ENT surgeon, a speech and language pathologist, oral surgeon, an orthodontist for braces. All of these individuals, we all come together for the care of these really complex problems. And that's the cleft lip and palate team. And so we are, in fact, the only cleft lip and palate team in Ventura County, Santa Barbara, and San Luis Obispo. So we have a huge catchment area of families that come and come to our clinic.
Well, Children's Hospital Los Angeles, for way back when, was the only place, and certainly there's a level at which we evaluate and go, is this in terms of an anesthesia or some outcome? We do send them down there. We really do want to get those kids who are there and don't know that we have a team here, getting something closer to home. Yeah,
I think the best care you can receive is the care that's closest to home at the highest standard, and that's really what we do. So, look, I've been very fortunate to be able to treat cleft lip and palate around the world, like through, similar to, and both in low-income countries as well as in Canada. And so this is a really high-level team that Dr. Starr and yourself have established over many, many years, and they make really, we make a big difference in the community. It's a real blessing to be a part of it.
Well, I think what people need to, in Honduras, babies die. You can't feed, you die. So one of our Ventura Global Health Program, there's a very cranky lawyer there, and I tell him about that, and he writes a check for $5,000, says, okay, get those kids from their villages into the hospital at the University of Tegucigalpa, and that's what we've done, is gone out, and these kids get on tuk-tuks, or they get in donkey cart, whatever, to the bus, and then we put them up overnight, and just make a tremendous difference. And we, in the business you're in, we present our hands and our face to the world. And so in terms of the miracle of it, and I'll have parents take pictures of their children with the cleft lip, which is, you'll talk about the repair schedule. And they go, well, why am I doing that? I go, because the baby that's coming out of the operating room, you're not going to recognize them. And you don't want to lose that baby that you had. So
I think there's nothing more special. That first cleft lip repair. So we do the first cleft lip repair typically around 3 months of age. So these are very small babies, and of course, as a cleft surgeon, I think it's super cute. How they have these little cute little smiles, and they're extremely cute. But there really is no other special moment in medicine or in life where you see a parent look at their kid for the first time after the operation, and they start crying. I know I'm going to start crying. And that's such a special moment, because it's so unknown what's going to happen. There's so many fears. There's so many, like, is my kid going to be okay? Is he going to be normal? Is my son or daughter going to be like me? Are they going to have trouble their whole life? And when they see the baby after the operation, and they realize that everything's going to be okay, that is like, there's nothing better than that. So, and we've gotten, cleft care has really changed. From the 1800s, when people started, just whacking clefts together, to now it's a really highly geometric, very precise procedure, and the outcomes are really good and they're consistent. So we, that's part of my job too, is to try and communicate that to the community of, like, what to expect. What can you how can we help these babies?
Well, it's such a three-dimensional thing, too. I
Yeah.
remember, God, probably 10, 15 years ago, bringing this experimental program we could rotate the head around
Yeah.
and so forth. And now you go to your pediatric dentist and they'll,
Yeah, they do.
hi, here's what's going to look. So,
It's coming.
how do you deal with things in three dimensions? Are there any special tools that have
Super
been
cool.
coming out?
Yeah, there are. I mean, there's lots of 3D, digital 3D cameras and photography that are currently being used to record. So to really document cleft repairs both before and after. And those are great because you can see everything in 3D. The next step is that we're now beginning to use that information to optimize the cleft repairs. So that's coming, and the use of big data and using all of that 3D information and quantifying outcomes, that's really the next level, to be able to make our cleft repairs look better and better and better and better, to the point in which no one can tell, like literally no one. Even cleft surgeons don't actually see it. So
The blob master getting those blob things.
that's
in the
you
right
got
place.
it. That's right. Yeah.
Are there any other special tools that you're using in terms of special scopes?
Yeah,
special.
we are. Yeah, there is a
What
3D
kind of-
digital microscopes. So, cleft repair typically is done with loops. So these are kind of like magnifying glasses that are a part of your regular glasses, and that's the traditional way that cleft repair is done, and most clefts are done that way. However, there is some evidence to say that using an operative microscope, so this is like an actual microscope, actually allows you a little bit better visualization, which then allows you to do a better job. And so I'm sitting on the advisory board of a company out of Santa Barbara that is actually developing a new type of digital microscope, which is a little bit easier to use than a regular microscope. And that digital microscope, we're using it for things like cleft repair, and we're still in the model phase of that, so I haven't brought it to real time yet, but certainly that's coming. So, and there's some exciting research that's being done about the utilization of digital microscopy to be able to optimize cleft repair, really do a better job.
Well, we think with the Da Vinci, they're collecting information
That's
about
right.
gallbladders. So pretty
right.
soon, who needs a doctor? I'll just push and you'll have so much experience with so many gallbladders.
This is it.
Every possible
is it.
complication, aberrant artery,
You got it.
will be there. So,
Yeah.
so collecting that information.
It's critical, yeah, absolutely, because we're starting to understand that, I mean, the future of medicine is in big data, is in using that data to our advantage to help people, and robotic surgery is part of that. So being robotically trained myself, I'm trying to use that new technology to improve outcomes and really determine how do we best serve our patients and our populations and reduce risk and improve the benefit of what we're doing. And those technologies they're all coming. Yeah.
And then you have some very special skills picked up in hands as well.
Yes. Yeah.
What kind of hand
surgery.
training or do you do to get that?
Yeah, to do hand surgery. Yeah, so in Canada, hand surgery is a fundamental part of our training. So we are the primary hand surgeons. In the U.S., it seems like it's really divided. There's a lot of orthopedic surgeons who do hand surgery, and there's a few plastic surgeons who do hand surgery. So that hand surgery is still part of my practice, both congenital hands, so that's the little kids, and adults. And of course, VCMC is a trauma center, so we see lots of adult trauma. And hand surgery is amazing because there's so much going on in such a small space. So there's nerves and vessels and bones and tendons, and it moves. And it moves in particular ways, and there's a balance to it that you don't find anywhere else in the body. So there's a real beauty to hand surgery, even though it's not aesthetic surgery. It's functionally a beautiful thing, and our hands are really the thing that separates us from all other animals.
Yeah,
so it's a very special thing, and if you don't have use of your hands, you really know it, and it really affects people's lives. So. Yeah, so we do a lot of hands.
I was back at the NIH in 2005. They were looking for the Iraqi war dividend.
Oh, yeah.
And this gruff, bearded veteran said, "Doc, all I want to do is be able to cut my own steak and eat it without help.
Yeah.
And so
Yeah.
we used motor sensors from Arabian horse racing because
Oh, cool.
they'd spend the money on things.
Oh, cool.
And finally, we've got it where
Yeah.
you can do that. And then in the shop right here at Vase,
Yeah.
we have a 3D printed hand, and with that, they can hold onto a bicycle handlebar, they can
Yeah.
throw a ball, they can take a dog for a walk.
Yeah.
Because your hand, again, it's your hands and face.
Yeah.
You're in the right place.
Absolutely.
Now, what are some of your other interests? So we've talked about your education,
Yeah.
your supportive wife,
Yes.
cleft lip and palate,
Yes.
hands. What other things are you involved in? Or
Yeah,
are you interested in?
So some of my tissue engineering. So this is really ways to put humans back together. And this is a new science that's really come out of a lot of the neat new inventions and nanotechnology that's happened over the past 20 years. And it's really exciting stuff. And so I've been involved in, specifically I've developed a new type of skin substitute, so what we call a nanomembrane, or it's like a wound dressing. And that particular dressing I developed out of the need in low-income countries. So, going to places like Honduras, or specifically Africa for me, there was a lot of kids predominantly who suffer these terrible burns. And burn care is really expensive, and burn dressings are super, super expensive. So there was a real need for a low-cost, high-technology solution. And so we did it. So I partnered with a lab that specializes in drug delivery, and we learned all of these new techniques to come up with these nanomembranes that basically you put on to allow you to engineer and reconstruct tissue. And so that's super exciting stuff, and we're learning more and more all the time and developing new ways to reconstruct people, and predominantly using these new nanofibers and nanotechnology, cell signaling in cells. We live in an amazing time. Like there's a lot of new things happening.
I know for Dr. Starr, we go down to Honduras, and the kids would be lined up with giant keloids on their bodies, and it was from climbing up the pole to steal electricity because they were light, and they'd try and zip it in and get blown off the pole.
Interesting, yeah.
So
I've seen that.
Yeah, things that we don't normally expect.
Yeah.
And then how about for pressure sores, since that's a very large problem.
You can. Yeah, absolutely. That's a difficult problem because usually there's a whole host of medical issues that surround that as well. But absolutely, like difficult wounds. So, complex or difficult wounds are wounds that involve more than just skin. So they go down, they go deep. They're into muscle. They're into the subcutaneous fats. Sometimes they go down. They're into bone. So then how do you reconstruct that? And traditionally we would use operative techniques, but we're getting better and better at non-operative techniques. So what else can we use? And negative wound pressure therapies and all of these new technologies that we're beginning to use and measure and quantify wounds with. That's going to be the key, and the thing that, in 20 years from now, it's going to be an obvious part of our armamentarium. So,
in the hospital, it's something as simple as turning every 2 hours. But having especially in the time of COVID, it's really hard to get people in there and make sure that people are left, right, out on their backs the whole time.
Prevention's the most powerful tool we have.
So then you have a daughter who rides horses as well. So you have a complete life as a dad, and a doctor's wife who's an Iron woman triathlon.
Yes, I do. Yes. Rodeo is a new thing for us, which is
from Canada.
But it's very cool, and we're very blessed and fortunate to be able to go, and she loves it. So we've got a new horse. He's a new part of our family, and it's pretty amazing. Barrel racing is very exciting. It's a real art to do it well. So I'm proud of her.
Yeah, and she
Yeah.
kind of backed into it in the usual way. Oh, let's get her
Yeah.
horse, so she won't get interested in boys. Want to get her horse lessons. Oh, she liked the horse lessons.
that's it.
Oh, she's pretty good at it. Oh, she's leading the pack. And so,
Well, and
yeah,
that's
I'm so
exactly what.
sorry. I'm sorry.
That's exactly
I'm
it.
sorry.
You know, everything happens in small steps, right? And the really powerful things that happen in your life really are just from one tiny step in front of the other, and then all of a sudden you look back and they're like, wow, you know, here she is riding this horse, you know, in this huge, you know, tournament in Las Vegas, doing really well. And loving it, and like, what an amazing thing. So yeah, you just never know where life's going to take you, and being open to that is pretty cool.
We started talking about, you and I walk on Sundays, and one of the things we're talking about is mentoring, and so we have a minute or so left. You had a very succinct sentence there about how we should, especially at this time of life, what we should do with our lives, which is be the person.
Well, what we were talking about, and I mean, you know, throughout all those, we talked about the stages and different levels of schooling that everyone, you know, goes through. And someone, you know, recently I read that you need to be the person who you needed. So when you were growing up, you knew that you were looking for someone. And you had that someone in mind, who that mentor would be, or I wish I knew someone who did this. And now, my job is to be the person that I needed at that time. So anyways, I'm thankful for you, you know, Chris, and I'm thankful for the time that we spend together, and it's always a blessing to me in so many ways that you don't even know. So you know, you've really been a great mentor to me, and I'm thankful for that.
Well, I have my own, as you and I have talked. Well, Ventura, a couple things. Cleft Lip and Palate Clinic, let people know they don't need to drive to Los Angeles for follow-up for their speech problems and so forth. Please support our Ventura County charities in terms of providing care for people. But most of all, for all of us, be the person that you needed for someone else, so that mentor a young person, mentor an older person, middle-aged, but just really leave your skills with others. Be the person you needed, Ventura. It's time for you to get moving and be the person you needed.